Okay, about the gastrointestinal assessment, first we start by inspection. We look at the patient we look at the abdominal area. We don't see presence of skin rashes, no bruises, no signs of trauma. We see that there is no hernia no umbilical hernia. We see that there is no inguinal hernia. And then we see that the patient is not icteristic, there is no jaundice. So we look at his eyes, we look at his mouth, if we see any changes at the tongue and the sclera. The tongue is dry. He presents thoracic breathing because abdominal breathing wouldn't be possible because he is in a lot of pain. The abdominal by look is distended and asymmetric. We see that in his hands he has no presence of hypocratic fingers, so no sign of liver impairment.
During the auscultation of the GIT tract, we're going to auscultate the entire abdomen. So we need to get the stethoscope, slide it all over the abdomen. During it, we're going to check the contractility of the intestines, of the functional working of it. We're gonna see there is a rigidity, the contractility, the work of them are going to be compromised. We're gonna not hear the most the specific sounds. It's gonna be rigid, so no sounds on it.
The patient to cough.
So we can also ask the patient to cough for this, and you can see distinction on the abdomen in the pain location areas because the patient going to feel it.
Okay, so we can do the Mendel sign. We put the quadrants in the abdomen, and then we do light typing. And while we do that, we can ask the patient where is pain. Okay, so we located the pain is in the right inguinal and right flank.
Percussion. So for check the percussion, we're gonna percuss in the entire abdomen, so we can observe a tympanic, non-specific sound here on the top of it because the causative of it will be the rupture of the appendix. So the gas present in the intestine will pass to the peritoneum, this part. So we're gonna observe the tympanic sound all over the top of the abdomen. So we can, for check it, we're gonna ask the patient to lay in the side. So this tympanic sound will pass to the top side of it, while it's down sound will be the bottom of it. We can also ask the patient to be seated, so we can also feel the tympanic sound in the top, in the liver region, so it's not going to be the normal donors here. And we can also check for the digitalis, the examination. So we're going to ask the patient to lay inside and like that, and we're gonna, with proper gloves, proper sanitation, we're gonna insert the finger here. We're gonna check the all points, so we can divide like hours, like 12. So 12, 11, 10, 9, and rotate the finger, and then rotate again like 3, 2, and 1 for checking pain present and inflammation in this local.
Okay, so our conclusion is that the liver is normal, but he presents GIT dysfunction due to pneumoperitoneal, and then the sound of, and there is presence of gas in the peritoneal area, and that is known because we cannot hear the liver.